Being in the hospital on a unit caring for patients with COVID is incredibly isolating. It's very isolating first for the patients. These patients only see their nurse or nursing assistant for the most part because they're the only people generally who are entering their room. These staff members additionally are wearing significant amounts of PPE, so it's very challenging for the patients to even recognize the caregivers that are caring for them. They have no friends visiting, they have no family visiting, and their only contact with their family or friends is through a phone or a tablet. Some patients are here for a few days, and some are here for a few weeks, and they are isolated the entire time. We do that in an effort to protect the rest of the patients and our staff in the hospital so that the building remains safe for everybody who needs to be here, but it's very isolating for those patients. Additionally, it's isolating for our staff. The nurses and nursing assistants are generally the only ones going into these rooms of these patients. So they're doing all of the duties that they used to have support from other staff members to do, such as cleaning patient rooms, drawing labs, delivering food trays, for example. The stressors for these staff members are huge. Patients with COVID-19 can get sick very quickly. The nurses are trying to care for these patients while also going into the room as few times as possible. And they're not able to have the door open, so they can't see their patients from outside of the room. So they're not able to do the monitoring that they're used to be doing. The staff are also concerned about taking the virus home. They're taking off scrubs or any clothing that was worn to the hospital before they even enter their houses. They can't hug their kids as their kids run to them to give them a hug after their day of work. They have to head straight for the shower. That's very, very challenging. This has been going on for 6 weeks, and we don't have an end date right now, which is even more challenging for the staff. They've really risen to this challenge, but it is a challenge. Stay at home because it feels so isolating. But this virus is very contagious, and it is so much more isolating being in the hospital. So we need to stay home to help stop the spread. Thank you for your support of healthcare workers.